Dr. Mugabe, very good morning to you. The issue we are having here with this is a serious one. The numbers seem to be growing, although there's progress at the same time.
Thank you, Braden, and thanks for this opportunity for us to talk about the issue that has been at the forefront the past few days. As you would recall, the Deputy President in his address and the Minister of Health focus on this issue about what we need to do around adolescent girls and young women. And also at the recent National AIDS Council, this issue was discussed and a call was made that we need to, scale up our efforts to address this issue. Let me just start by...
Now, Dr. Mugabe, sorry to come in there. Sorry, just a time issue because we might have to take the President live shortly. Those efforts, what should they involve going forward to assist the young women and the teenage girls?
I think it's about scaling those programs that we already have that we know work. One of those is that we need, for instance, to look at what actually, where are the new infections are taking place among these young women. And it's very clear that these are not evenly distributed. Most of the infections are taking place in the 8 metros, and we need to make sure that we actually focus in those areas. But let me also say that there has been significant progress, between 2010 and 2019 in reducing the number of new infections among adolescent girls and young women. In South Africa, in particular, we have had about a 56% decline. But this decline is not big enough, it's not fast enough for us to meet the targets set up in the National Strategic Plan. So it's really about empowering young girls, deal with the power imbalance between young girls and their sexual partners, and also, frankly, now also putting men on treatment, because a study done by Caprisa, led by Professor Koresha Karim, clearly shows that, in fact, adolescent girls and young women are infected by men who are at least around 8 years older than them.
Okay, Dr. Mugabe, I'm very sorry. I'm sorry, we have to leave it there now.